Hi, my name is Savannah Cotter. I'm going to be presenting co-infection of bacterial vaginosis and Mycoplasma genitalium in pregnant women. Bacterial vaginosis is a common infection in women of reproductive age, and it has a prevalence of about 29.2% in the US. It's often asymptomatic, but can be associated with pelvic inflammatory disease and preterm delivery, as well as increased risk of STIs like chlamydia, gonorrhea, and HIV. Mycoplasma genitalium is an emerging STI that has also been associated with pelvic inflammatory disease, adverse birth outcomes, and infertility. The goal of the study was to investigate the association between the two of these organisms. As we conducted the study, we looked at women aged 14 to 16 with a pregnancy between 2019 and 2020, and we looked at endocervical samples of Mycoplasma genitalium through transcription-mediated amplification. BV was tested by wet mount or transcription-mediated amplification, depending on provider preference. And we looked at all this information through chart review. So for the results, we found Mycoplasma genitalium. We did testing on about 1,211 samples, and 3.39% were positive. 600 of those women had BV testing during their pregnancy, depending on their provider and their symptoms, and 32.7% of those were positive. Data analysis using chi-square analysis with the chart and information shown in table figure 4 showed that M. genitalium infection was significantly associated with BV co-infection with a p-value of 0.04. You can see in the pie charts in figure 1 that in the MGen positive population, almost 50% also had BV, whereas in the M. genitalium negative population, it was a much smaller percent of patients with BV. We also looked at demographic data such as age, which showed that the mean age of women with M. genitalium was younger significantly, but this age difference was not noted with BV patients. We also ran data on race and ethnicity, which showed that a higher percentage of Black patients had M. genitalium and BV co-infection, and a lesser percentage of patients of Hispanic ethnicity were significantly less likely to have M. genitalium or BV. In conclusion, bacterial vaginosis infection may be associated with an increased risk for Mycoplasma genitalium infection. And although Mycoplasma genitalium is an emerging STI in pregnant women, it has been associated with adverse birth outcomes and pelvic inflammatory disease. Treatment of BV during pregnancy may be important to prevent adverse perinatal outcomes associated with Mycoplasma genitalium, but further studies are needed to determine the outcomes associated with both of these organisms and whether testing is needed during pregnancy. Thank you.